So the next question is about sort of genetic aspects of epilepsy. So this lady had a son who is now 35 years old, who I believe had seizures at the age of 4 to 5 years old, and the doctor at that point told parents that he had a benign epilepsy and he will outgrow. And it sounds like he did. So he's not having any active seizures or anything at this point. However, the concern is that he is having a child and concerned about the child having epilepsy in the future. So let me just try to summarize the history again. So this benign childhood epilepsy is very, very common. It happens around 4 to 5 years of age, and it could last up to 12 to 13 years old. Typically, this benign childhood epilepsy stops or remits spontaneously with or without medication before or during puberty. So this is a very well-known phenomenon, and we, as a neurologist and epileptologist, do not fully understand why that happens. May have something to do with brain maturation, hormonal effects on developing brain, and so on. Nevertheless, there is a certain percentage of children who has this benign childhood epilepsy, and their parents had it in the past. So the rate of genetic or hereditary tendency of this condition is probably, I would say, less than 5%. So majority of benign childhood epilepsy is sporadic, meaning that there's no family members affected, and there's very minimal chance that it could be transmitted to next generation. So at this point, I do not see any reason why you should be concerned or worried about the baby having epilepsy in the future. If so, it will be still benign childhood epilepsy, which does not have any long-term implication. When the baby develops, for example, a benign seizure, in the future he could be treated with a very small dose of medication, and he will do very well. I guess that's the answer.